Hello, I'm Dr. Michael Lau. This presentation, titling Refinements in Labioplasty, was a professional technical presentation I gave at the AMEC conference located in Paris in 2016. The audience were mainly aesthetic physicians and surgeons, but I think this presentation might be informative and of interest to the general audience as well. This presentation is designed to answer the questions such as what factors contribute to the success of labioplasty? What techniques are used for labioplasty? Does labioplasty change the sensation of the vaginal area? What are the new refinements in labioplasty that give a successful outcome in terms of function and aesthetics? So I'm doing a voiceover of the presentation I gave during the conference. Let's go over the presentation. The two most common techniques that we use in labioplasty are the linear resection technique or the wedge resection technique. In both cases, you can see the photograph, a certain part of the labia was removed and repaired and stitched back together. So a question is asked, does linear resection affect the sensation of the labia? And we're going to answer that with a study that I have done. The labia minora are important in sexual function. They contain specialized vascular element that will engorge during sexual excitation. It's not an erection per se, but it's an engorgement, make the area more tense. Also, the labia minora contain dense nerve endings inside the inner border, more so than the outer border. And during sexual excitation, the engorgement adding to the sensory input from the nerve endings will enhance sexual excitation. And those are the factors we need to consider when we perform labioplasty. So many patients are concerned whether labioplasty using any technique, in particular linear resection, would affect the sensation of the labia after the surgery. This is a very fair question. So I've conducted a prospective study with 20 patients, checking the sensation, both touch and pressure, before and 6 weeks after labioplasty using the technique that I use, which is a modified resection technique. And the finding is outlined on the diagram. And the conclusion is there's no decrease in sensation of the labioplasty. So what are some of the refinements I mentioned in the technique of labioplasty that will help to preserve the sensation and function of the labia? I think first principle is to recognize that labia minora are important for sexual function. So when we do labioplasty, it's more than just aesthetic, it's functional as well. And that labia minora contain specialized vascular elements that are important for sexual function, and that the inner surface, the inner border of the labia minora contain a lot more dense nerve endings than the outer border. So we should avoid using energy device excessively, such as excessive electric cautery or using laser that might destroy some of the nerve endings and vascular tissue by heat energy. We should avoid that. I think we should use sharp and precise dissection and approximation of the labia minora tissue to avoid any tissue trauma where overtensioning that might affect the specialized vascular tissue of the labia minora and nerve endings. And then use fine and rapidly dissolving sutures. I think labioplasty can be done using only local anesthetic. They'll have a less anesthetic risk, shorter recovery, and more cost effective. You have a further question or need more information, please go through my video library that will discuss the various topics in vaginal cosmetic surgery. Also visit my website, I'll outline, And if you need a phone consultation, happy to do that from anywhere in the world. Thank you.